Hi, hello everyone. Welcome to Agni Nursing Academy. I am Prakash Pudki. Yeah, here one date is there. I have mentioned here 14 November 2025. Every year 14th November we will celebrate it as a Children's Day. But our nursing aspirant there is the examination on that day, that is Kgmu. Okay, this examination held on that day, and this examination there will be the 70% 70 questions nursing and 30 questions will be on non-nursing. Please note this one and move on to the first question, that is identify the given image. That option 1 is CVP catheter, Fogarty catheter, endoscopic tube and Sungstaken blackmore. See, directly I will select the answer of this question is Fogarty catheter. Then I will explain about this. We can call it as we can also call it as the Fogarty catheter or Fogarty catheter. Okay, don't confuse. Fogarty catheter, Fogarty and Fogarty. So coming to the structure of this question, this image is here at the distal end there will be the inflammable balloon, inflammable balloon, and this wire is flexible and thin and long. Also here one connector also there for syringe or byway canal also. Okay, then where we will use this Fogarty catheter? We'll use in the thrombectomy or embolectomy. Thrombectomy or embolectomy. So here in the vascular system, the clot or emboli form in the particular vein or artery. That time we have to insert this catheter inside the vascular system, and we have to inflate the balloon, and we have to remove the catheter. By this way, we have to remove the emboli or thrombus. Okay. Then one more use is there, foreign body removal. Okay, foreign body removal. By same thing we have to do in the foreign body removal. We have to insert the catheter inside the esophagus, post to the that obstructive thing, and after that we have to inflate and we have to remove the catheter. Okay, then coming to the size of this catheter, see here we are inserting the catheter inside the blood vessel, so its size will be too much thin. Okay, that one 2 to 7 French. So whenever French comes means we have to know about the outer diameter. Okay, this is outer diameter. Then coming to the inflation. Okay, how to inflate this one? We have to inflate with the normal saline. Okay, normal saline or that contrast media. Contrast media, sorry, or CO2. See, this contrast media and CO2 we will use rare condition, but NS we have to use the commonly NS we will use to inflate that bulb. Okay, then coming to the next one, most important in this catheter insertion. If we insert this one now, after we have to inflate the balloon post or distal to the thrombus or emboli. See, if we inflate the balloon before means this emboli or thrombus can't come out. So we have to show here, this is our vein or blood vessel. Here clot is there. So this is the distal proximal end. This is distal end. We have to insert the catheter from here up to here. We have to come. Okay, distal to the thrombus. After that we have to again inflate the balloon, and after we have to again pull it back. So this is the procedure. This is the Fogarty catheter or Fogarty catheter. Then let us move on to the next question. Select the non-shockable rhythm of cardiac arrest. See, in this question they asked the non-shockable rhythm. There are two types of rhythms are there. That one, shockable rhythm and non-shockable rhythm. First we will discuss the shockable rhythm. One trick is there where V comes means we have to give shock. Okay, Here I will tell you one. There are two rhythms are there. First one, ventricular fibrillation. Second one, pulseless ventricular tachycardia. Okay. Here you know about the ECG linings. If ventricular fibrillation happens means there will be, we can't identify the which way it will be like anything. Okay, we can't identify the electrical activity. Irregular electrical activity will be there. Electrical activity. Here in pulseless ventricular tachycardia, there will be the rhythms, regular rhythms. Okay, rhythms. Okay, but so fast we can't palpate the pulse. We can't. There is a no palpable pulse. So we can't palpate the pulse in the pulseless ventricular tachycardia. So in these two rhythms, we can give the shock. And then coming to the how we have to treat this, we have to give the defibrillation. We can give defibrillation, and after that CPR. After that medication also we can give that one, epinephrine and amiodarone. These are the treatments in the shockable rhythms. Okay, important. We have to give defibrillation, we have to give the CPR and epinephrine. We have to give the epinephrine every 3 to 5 minutes, and amiodarone after 3 shocks. Okay, after 3 shocks. After 3 shocks, we have to give the amiodarone. Then coming to the non-shockable rhythms, first one asystole, and second one electrical activity. Okay, pulseless electrical activity. See, these two rhythms we can't give the shock. Defib we are not supposed to give the shock. See, asystole means there is no pulse, no electrical activity. Then coming to the pulseless electrical activity, here we no pulse. Okay, there will be no pulse, but irregular activity, electrical activity will be shown in the ECG linings. Okay, then in these two we have to give the only CPR and medications. Okay, in non-shockable rhythms we have to give CPR and medications. In shockable rhythms we have to give the defibrillation, after that CPR, again medications. Okay, then coming to the question, select the non-shockable rhythms of cardiac arrest. These all four are rhythms of cardiac arrest only. We have to select the non-shockable. Okay, here ventricular fibrillation we can give. Okay, then pulseless electrical ventricular tachycardia, yes, we will give the shock. Then option D, all of the above, no. Here non-shockable rhythm is there. Okay, option A is the correct answer of this question. Then move on to the next question. Which is the best site for IM injection? See, again this is a simple question. In the this RML, Kgmu, Sgpgi, in these examination they will ask like these questions only. Okay, see here IM injection they are asking. Okay, sorry, IM injection. There are 4 sites, important sites of IM injections are there. That first one, deltoid. In deltoid we will use in the adult only. Okay, adult, and maximum dose of volume of the injection is will be the 1 ml. Okay, then coming to the vastus lateralis. We can use in the infant and younger children's. Okay, younger children's also we can use. So here this is the best site for the infant. Okay, best site for infants, vastus lateralis. Then coming to the ventrogluteal, yes, we can use in the adult and older children, and this is the safest. Okay, this is safest intramuscular site. Okay, and this site is avoid the nerve injury. Okay, there is no risk of nerve injury in this site. So this is the uh, this is important site and best site for IM injection. Then coming to the dorsogluteal, this is the site IM site in the adult. Okay, we can use in the adult, but there is the risk of nerve injury. Okay, risk of nerve injury. Okay, there is a risk of nerve injury, and this is called as a traditional method of IM injection. Okay, this is the traditional site. Traditional site. See, this is the you have to remember this one, traditional site. Okay, already previously asked in the UPMS examination. Okay, in UPUMS they asked the which is the traditional site of IM injection. The answer will be the dorsogluteal. Okay, then coming to the options, what they have asked, which is the best site for IM injection, deltoid versus lateralis, dorsogluteal, ventrogluteal. See, if they didn't mention anything means we have to uh, select as a adult. Okay, in the adult we will prefer the ventrogluteal is the best site for IM injection. Then coming to the on to the next question, that is main purpose of cold application is when we will use cold application. Then coming to the options, to increase the circulation, to reduce the swelling and pain, to soften the tissue, to promote the muscle relaxation. See, in this question they asked about the cold application. We can call it as the cryotherapy. Cryotherapy. So what is this cold application? We have to apply the cold or ice to the body part or whole body. Okay, we can use the ice or ice cube on the part of the body, or we can use to the whole body. Why we have to use this cold application? We will to reduce swelling, and inflammation. Then which one? Next one, to control the bleeding. In control of bleeding, we will use a cold application. Next one, to decrease the body temperature also. Body temperature. Okay. Then next one, prevent the edema also. Okay. See, don't confuse with the prevention of edema and that in the case of already patient having the edema means we are not supposed to give the edema this cold application. To prevent the edema is important. So okay, this is important, prevention of edema. If the patient having the edema, then we are not supposed to give the cold application. Okay, then coming to the action, how will it works? See, if to reduce the swelling and inflammation, we have to, it will act as the vasoconstriction. Okay, vasoconstriction. Vasoconstriction will happen when we apply the cold to the particular part. By constricting the vein, it will reduce the blood supply and capillary permeability also. Then next one, numbness. Numbness means nerve conduction, it will slower the nerve conduction. Then how, then decrease the metabolism. Okay, so how it will decrease the metabolism means if we apply the ice cube to the particular tissue, it will decreases the oxygen need and energy need to the tissue. So decrease the metabolism. By the decreased metabolism, there will be the oxygen will be decrease in the metabolism. Then decrease the capillary permeability. So decrease capillary permeability. How means if we apply the cold application to the particular area, in that particular area there will be the blood vessels will be there. By applying on that, veins will constrict. So this semi permeable membrane will be there in the every vessels. So that vessels become too smaller. Okay, they won't permit to go out and inside the vessels. So capillary permeability will decreases. Okay, don't confuse. Decrease the capillary permeability. Then where we have to use this code application? What all are the indications we have to use in the sprain and strain? There will be the so much pain and swelling in the sprain and strain condition. So we have to reduce the that swelling and inflammation in that particular area. We have to apply the code application. Then next one, acute injury. So if means acute injury means in the bleeding condition, we have to apply the code to stop the blood. Okay, stop the bleeding. In the acute injury, we will use as use the code application to stop the bleeding also. Then in the fever condition, like cold sponge. Okay, fever management we will use and uh, tooth extraction will be there. Whenever you will go to the dentist, they will remove the tooth. That time they will tell keep the ice cream or ice pack on the particular area to for that to reduce the swelling and to reduce the slower the nerve conduction, to reduce the pain also. Okay, after tooth tooth extraction, this is your cold application. Okay, then coming to the options, that is to increase the circulation. No, it will decrease the circulation. Then to reduce the swelling and pain. Yes, this is the correct answer of this question. Okay, to reduce the swelling and pain. Then if we give the hot application in the swelling condition, it will increases the blood supply and it will increase the inflammation and increase the swelling also. So no need to give the hot application to the swelling condition. Then move on to the next question. The maximum time limit for the storing BMW before transportation to the treatment facilities. Here in this question, they asked the how much time we have to store the waste within the hospital storage area. We will collect all waste from the different department and we will transport to the particular storage area of the hospital. Okay, this is in the particular area they will store the waste in the hospital storage area. In this area we are not supposed to store the waste more than 48 hours, sorry. Okay, more than 48 hours we are not supposed to store. Okay, then correct answer of this question is D. We are not supposed to store waste more than 48 hours. Then what about the covid waste? Covid waste we are not, we will empty this dispose the covid waste within the 12 hours. Okay, then coming to the some important guidelines which are started in the 2016. Okay, here we are avoid the recapping of the needle. There will be the injury, chance of injury, needle stick injury will be the more chances in the recapping. So we are not supposed to recap the needle. Okay, then coming to the next one, we have to cut the needle. Okay, we have to cut the needle. In the some of the hospital there will be the needle cutting machines are there. We have to cut our D shape. Okay, D shape the needles. Then because no need to recycle, that's why there is a cutting of needle and reshaping. Then next one, must empty the container. In the ward we will segregate the waste, but when we have to empty the that collection bag, no one that is 2/3 or 75% of after filling 75% we have to empty. Okay, this is most important. 2/3 or 75%. If the bag is full means we have to empty the bag. Then what all are the 3Ds of BMW? This is also the important 3Ds. Okay, first one is disinfection. That one, next one drainage, and third one is dispose. These are the 3Ds of biomedical waste management. Then move on to the next question. The main difference between the felony and misdemeanor. Here this is the main difference between the felony and misdemeanor. What is this felony and misdemeanor means? These are the crimes. These are the crimes. That is, they are asking the difference between these crimes. What is felony and misdemeanor? See, felony is the serious and this is minor. Okay, minor crime. This is serious one, and we have to punishment will be there in the felony, that is imprisonment imprisonment more than 1 year. Okay, here in misdemeanor there will be the imprisonment will be there, but less than 1 year, and fine also will be there. For example, there is a murder or rape or use thief, theft. Okay, then coming to the misdemeanor, there will be the small robbery. Okay, small thefting and negligence means there is a minor mistakes are there in the misdemeanor. In felony there will be the imprisonment more than 1 year and misdemeanor less than 1 year, or fine also. Okay, then coming to the options. Sorry, felony involves lesser punishment. No, there is a imprisonment. Okay, then felony is more serious with the harsh punishment. Yes, this is the correct answer of this question. Felony is more serious and harsher punishment. There will be the more punishment, more fine also will be there. Then coming to the option C, felony is only the civil offense. Yeah, this is the civil offense, but this is a more serious offense. In civil offense, there will be the negligency. Okay, there is a tort that are civil offenses. Then felony in the hospital rule violation. This is under the misdemeanor. Okay, this is misdemeanor. Correct answer of this question is B. Then move on to the next question. Which of the following shows the correct order of infection stages? Here they are asking the sequence of the infection stages. And then I will tell you that by the graph. Okay, here this is the graph. See, this is the incubation period. Here incubation period is there. Then here prodromal. Then here illness stage. Then next one decline. Then convalescence. What is this incubation period? Incubation period means there is the entry of infectious organism to the first sign and symptoms. Okay, first sign and symptoms. Entry of an infectious organism to the first sign and symptoms, that is the incubation period. Then what is this prodromal stage? In prodromal stage there is a general sign and symptoms. Okay, general sign and symptoms. There is no we can't predict the diagnosis. Okay, no proper diagnosis we can identify. So in this is the contagious stage. Okay, contagious stage, because we can't identify the diagnosis of the condition. Okay, there are only general sign and symptoms will start. Then in illness stage, this is the stage where the peak sign and symptoms. Okay, peak sign and symptoms, and we can diagnose the condition by the symptoms. We can diagnose, and this is a peak illness of the condition. Then coming to the decline, here the body starts to respond. Okay, body starts to respond, and our sign and symptoms will starts to decrease in the place of decline. Then coming to the convalescent, this is the whole body recovery. Okay, body recovery will be there in the last stage. This is your infectious stages. Then coming to the option A, prodromal, illness, incubation period, decline, convalescence. So this is wrong. Okay, this is wrong. Then option B, incubation period, prodromal period, illness, decline, convalescence. Yeah, this is in the proper sequence. First we'll start with the incubation that infectious agent entry to the susceptible host, and it will start to the first sign and symptoms. After that, there will be the general sign and symptoms. After that, there is the particular sign and symptoms of the condition. This is the stage of illness, and after that, body starts to respond to the disease condition, and sign and symptoms will decrease. Then convalescent will be, there is a recovery of the particular person who is infected. Then this is the option B is the correct answer of this question. This is our today's session, and again I will come with the important topics. And download the Agni Nursing Academy. There will be the test series for your improvement of skill and